excited about getting a Democrat in office. And when I hear you speak, I get really excited. But I remember that Trump excited his base with a promise to build a wall with no real plan to pay for it. Your plan for free college tuition and Medicare for all seems like a way to excite the Democratic base, but with no real plan to pay for it. Now, how is your position in your campaign different than what Donald Trump did?
Oh, I think, you know, given the fact that I've spent my entire adult life fighting against everything that Trump stands for, trust me, we're a little bit different.
But
Here's what I want to do. First, I'm going to give this to you. I thought that question might come up. All right, here it is. This is a list which will be on our website tonight of how we pay for every program that we have developed. Okay. But let me give you some examples. Okay, you asked a good question. Here's the answer. You're right. I believe that we should make public colleges and universities tuition free, because in the year 2020, when we live in a competitive global economy, I want all of our kids, regardless of income, to be able to get that higher education, college or trade schools. By the way, I also believe we should cancel all student debt in America. Okay. Now, you're smiling and you say, well, that's a great idea. How does he pay for it, right? Did I read your mind on that one? Okay. And the answer is, I'll tell you exactly how we pay for it. We pay for it through a rather modest tax on Wall Street speculation. That is how we pay for that. All right? You will remember 12 years ago, the Congress, against my vote, bailed out the crooks on Wall Street who nearly destroyed this economy. I think a modest tax on Wall Street speculation right now to make sure all of our kids who have the ability and the desire get the education they need is something that we should do.
You're slick giving me this piece of paper.
I know.
I couldn't pay
know.
The criticism is there is a lot of detail in here. You can look for it for yourselves on the website. It is not matching the price tag that some put at about $30 trillion for the Medicare for all transition. You do have lots of different ideas in here. I'm not saying you don't. But you get about halfway there. No. The question becomes, how do you get the rest of the way?
Well, we get there. You know, there was a study, Chris, I don't know if you happen to see it. I don't know if anyone...
$30 trillion over 10 years.
A study came out from Yale University, a number of epidemiologists, a really quite good study, published in Lancet, which is, you know, a major medical journal. What they said is when you get rid of all of the administrative waste that we have now, having to administer, you believe that thousands and thousands of separate plans. You have a $5,000 deductible, you have a $10,000, you're in this, that, you're in that, you're covered with this prescription drug, you got that. It is a disaster. When you get rid of all of that administrative waste, which other countries do, when you get rid of the profiteering of the drug companies, we can, in fact, pay for Medicare for all and substantially lower the cost for the average American worker. Now, you want to know how we're going to pay for it? Well, we can go on for several hours very briefly. Number one, for the average person, how do we pay for it today, Chris? You know how we pay for it? The average family in America makes about $60,000 a year. That family is paying premiums, deductibles, out-of-pocket expenses, and co-payments. That $60,000 a year family is now paying $12,000 a year for health care. It's an outrageous sum of money, about 20% of the family's income. What we do, among other proposals in there, is to say, all right, you are that average $60,000 a year family. You're going to pay a 4% tax, exempting the first $29,000, leaving $31,000 of taxable dollars, which is about $1,200 a year. A heck of a lot better than what you're paying today. We also have a payroll tax. We have a payroll tax on employers, which will save them substantial sums of money. Because remember, under Medicare for all, no more premiums for the worker or the employer, no more out-of-pocket expenses, no more deductibles, no more out-of-pocket expenses. And because we're taking on the greed of the pharmaceutical industry, nobody in America under Medicare for all pays more than $200 a year for prescription drugs.